The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines podcast series. My name is Shannon McKernan, and today I'm interviewing Dr. Christopher Flowers, an author on Outpatient Management of Fever and Neutropenia in Adults Treated for Malignancy, American Society of Clinical Oncology, and Infectious Diseases Society of America Clinical Practice Guideline Update. Thank you for being here today, Dr. Flowers.
Thank you, Shannon.
First, can you give us a general overview of what this guideline covers?
Sure. Neutropenia is a general decrease in the absolute neutrophil count that occurs in individuals who receive chemotherapy. And since neutrophils are really critical in providing host defense against infection, a decrease in the neutrophil count or neutropenia puts individuals at risk for infections, particularly bacterial and fungal infections. In the situation where a patient is neutropenic after receipt of chemotherapy, fever can be a very important indicator and sometimes can be the only sign or symptom that someone is developing an infection. And clinicians should be mindful that any patient with neutropenia, once they develop a fever, may have a serious infection. This guideline is really an attempt to help clinicians to manage patients who have both fever and neutropenia. And it is the first time that it provides an updated joint guideline between the American Society of Clinical Oncology and the Infectious Disease Society of America. So it's the first ASCO IDSA joint guideline on outpatient management of fever and neutropenia. In addition to what I just mentioned about fever and neutropenia, that is most commonly a kind of a situation that requires hospitalization. This joint guideline is an attempt for ASCO and IDSA to be able to provide insights about how best to manage those patients when the opportunity exists to manage those patients as outpatients. To put together this guideline, ASCO and IDSA convened an updated expert panel built from the expert panel for the original ASCO guideline and experts from the Infectious Disease Society of America. And we conducted an updated systematic review of relevant studies, and the guideline recommendations were based upon this updated review and input from the expert panel.
So the last version of this guideline was published in 2011. What has been updated in this new version?
So as I mentioned, ASCO and IDSA are the two groups that joined forces to work on this guideline. The IDSA's guideline, the Clinical Practice Guideline for the use of antimicrobial agents in neutropenic patients with cancer, was released in 2011. And in 2013, ASCO released a guideline on the antimicrobial prophylaxis and management of patients with fever and neutropenia. Since that time, there have been 6 new or updated meta-analyses and 6 new primary studies that were examining the criteria that were listed in the updated systematic review. And this guideline utilizes those new data from the meta-analysis and 6 new primary studies to be able to provide new recommendations based upon that evidence. In addition, this guideline uses the grade system of evidence, so the grading of recommendation, assessment, recommendations, and evaluation system that rates the quality of evidence and determines the strength of those recommendations. In particular, guideline focuses on the question of which patients with fever and neutropenia can be managed as outpatients and what are the appropriate interventions for those patients. Our main target population was looking at patients with cancer who require treatment for fever and neutropenia, and to be able to target interventions that can help to guide the management for oncologists, infectious disease specialists, emergency medicine physicians, nurses and advanced practitioners, and anyone who may treat patients with neutropenia resulting from a cancer treatment. The expert panel that was involved in this literature review based our guideline recommendations on the new evidence from the systematic review of the medical literature.
So what are the key recommendations for this guideline?
So our main recommendations stand fairly similar to the recommendations that we had in the past, plus a few additional updates. Our panel continues to endorse the recommendations from the previous version of this guidelines that patients with fever and neutropenia receive an initial dose of empiric antibacterial therapy within an hour of being triaged and to be monitored for at least 4 hours before they are discharged for outpatient management. Our main recommendations are that a patient be managed with an oral fluoroquinolone plus amoxicillin clavulanate for empiric outpatient therapy. For patients who are penicillin allergic, clindamycin can be substituted for amoxicillin clavulanate. These management strategies hold true unless a fluoroquinolone was previously used as prophylaxis before the fever developed. We outline two major parts for management of patients who have the potential to be managed in the outpatient setting. First, identifying patients and triaging patients who are neutropenic with a fever immediately, assuming that bacterial infection has occurred, and then documenting fever and drawing pre-treatment blood samples, performing an assessment to determine whether this patient might be appropriate to be managed in the outpatient setting, and administering empiric antibiotics within 1 hour of the triage time point. In addition, we describe some of the strategies for identifying candidates for outpatient management, and that includes using a system like the MAS scoring system or Talcott's groups, which can help to identify patients who may be at higher risk and require inpatient management. Secondarily, there are other systems like the CISNE tool that can help to define low-risk patients who might be appropriately managed as an outpatient. Using these tools can be quite helpful in determining when outpatient management of febrile neutropenia is reasonable and appropriate. And for any patient for whom there are viewed to be increased risks in the view of the patient or the clinician, I think it's reasonable to move ahead with inpatient management and admission of those patients. Additional criteria for when outpatient management is appropriate are included in the guidelines.
Are there any important cost considerations of neutropenic fever syndromes?
In the setting of neutropenic fever management, most of the agents that we consider using in the outpatient setting are antibiotics that can be used as generics or with multiple products available, like the fluoroquinolones or amoxicillin clavulanate or clindamycin. And so the cost considerations for the actual administration of antibiotics is relatively limited. But if these guidelines are appropriately utilized for patients, they do create situations where there might be cost savings as a result of reduced ER visits or as a result of reduced hospitalizations.
And finally, how will these guideline recommendations affect patients?
Patients with fever and neutropenia occur quite commonly in the routine management of patients with cancer. And this is a result of chemotherapy administration, which very commonly causes neutropenia. And during the period of neutropenia, about 40% or sometimes more patients may experience a fever. When this happens, the routine management traditionally has been for patients to be admitted to the hospital, receive intravenous antibiotics, be monitored with blood cultures in the hospitalization until fever and neutropenia resolve. This is appropriate for many patients who have prolonged fever or prolonged neutropenia or both, and for patients who have excessive risk of untoward outcomes with fever and neutropenia. And those are patients that can be defined using the MAS score or Talcott's group as the higher risk patients. However, for some patients who have relatively uncomplicated fever and neutropenia, they can be safely managed as outpatients. And that can provide a great benefit to individuals for not having to go into the hospital or maybe even not having to go into the emergency department. And we are hopeful that this guideline can provide a benefit both to patients and to their providers and caregivers in this way.
Thank you for your time today, Dr. Flowers.
Thank you.
And thank you to all of our listeners for tuning into the ASCO Guidelines podcast series. If you've enjoyed what you've heard today, please rate and review the podcast and refer the show to a colleague.